Let's talk about what an open abdomen is and what that means for our patients. So we typically have an open abdomen when we do in trauma or acute care surgery, damage control surgery. So a patient is so unstable or there's such a catastrophic situation going on that we have to leave the abdomen open. So on the abdominal wall here, we performed an exploratory laparotomy and now the wound is open. And when a wound is open like that, that means the intestines can eviscerate out of the abdomen. So in order to deal with that, what do we have to do? We have to place a special type of vac, and we call it an abthera. So this is a negative pressure wound vac therapy system that's made specifically for open abdomens. Here you go. And we place this into the wound here. It's typically a blue sponge, and then it has a clear sealant, sticky thing that goes over this to create a seal, okay? So this is very different, though, than if the fascia were to be closed and you simply have a wound vac in the wound. That is dramatically different than a true open abdomen. And so what we would then do is we would go back in 24 to 48 hours and we would take another look at the intestine or thank you, or whatever other issue is going on, and then do the definitive repair, okay? And then these patients are going to be very much prone to getting anterior abdominal wall hernias. And the feared thing here is when you have an open abdomen is we can have complete loss of domain to where they truly then have a massive anterior abdominal wall hernia. And that's when we have to go in later or immediately, which I talk on a lot, and do an abdominal wall reconstruction where we have to release the muscles here. There you go, sir. And do what's called myocutaneous trunk flaps and separation of components to bring the fascia and the rectus muscles back to the midline. So that's a really complex operation. We do them, and sometimes plastic surgeons do those types of procedures as well. But this is what an open abdomen is.